Assessment to Eclectic Music Therapy Approach by Mir Shahabuddin Chilan. You cannot teach a man anything. You can only help him find it within himself. Galileo Galilei. Cognitive Behavior Therapy. Cognitive behavioral therapy is a psychosocial intervention. With help of cognitive behavioral therapy, therapists teach people and their clients to change their thoughts, cognition, and their behaviors. The aim is to assess the negative thoughts a person is having about themselves and their view of the world, and to change them with more positive and constructive thoughts and behaviors. CBT tries to offer a holistic approach to mental health care by addressing the thoughts and behaviors which contribute to the development and maintenance of problems. It is good to be mentioned that this treatment was designed to treat depression originally, but its use has been expanded to include treatments of a number of mental health conditions, including anxiety. In its simplest form, CBT requires only two things: learning and doing. A person undertaking CBT will learn coping skills and techniques, both ones that are pertinent to their health issue, and more general ones that will help with everyday life. They will learn about their health condition and how it is being maintained. This aspect of CBT is that knowledge is power. The more someone knows about their own disorder, the better equipped they will be to recognize its symptoms and do something about it. Cognitive behavior therapy is a talking treatment that aims to change the way a person feels by altering how they think and behave in everyday situations. Many cognitive behavior therapists will have used metaphors, stories, and images in their clinical practice. Family-centered practice. Despite a lack of clarity in the terminology used during the early years of this model, words such as family-centered, family-focused, and family-based were often interchanged. The use of term family-centered has now become more carefully defined and consistently applied across service sectors. Family-centered practice is based upon the belief that the best way to meet a person's needs is within their families, and that the most effective way to ensure safety, permanency, and well-being is to provide services that engage, involve, strengthen, and support families. Family-centered practice has been internationally recognized over the past several decades as being highly relevant in the design and delivery of children's services. To varying degrees, it has been incorporated into programs of service delivery in child developmental disability, child health, child mental health, and child welfare. In many ways, the operational definition of family-centered practice has depended on the service context in which it is applied. It can mean different things when applied in community-based family support programs, such as child disability services, in highly specialized services such as pediatric surgery departments in hospitals, or in mandated services such as child protection. Culture-centered music therapy. Music therapy is a multicultural activity because deals with people and each person has his or her culture. Due to the events such as globalization in 21st century, we can see multicultural communities in the world. In this condition, music therapists should equip themselves to work with clients of different cultures and backgrounds. It is important that music therapists note that only the cultural condition of the client affects the therapeutic process, but also cultural background of himself or herself has an essential role in this process. Although we can mention several difficulties that the therapist face with them while working with clients of different cultures, such as different religions, customs, and beliefs, language barrier is the most problem of therapists, as language is the main key of communication. Without common language, the result of sessions may be influenced. We should recognize how our cultures shape our ethics and morals, and how these factors influence our identities as music therapists. After that, we should understand of cultural knowledge of other ethical groups and the role of music in those cultures. With help of this knowledge, therapists are able to form cultural relationship with their clients. Consequently, clients will not experience a lack of trust and disconnection. Northrop Robbins music therapy. In this eclectic music therapy approach, Northrop Robbins music therapy is very helpful and suitable for refugee families and their children. Also, all minority groups can be supported by this eclectic approach. By visiting different nationality, race, religion, gender, sexuality, ability, or class, Northrop Robbins music therapists can attain experience and awareness of other people and behave more efficiently. Therapists who are enough equipped with cognitive behavioral therapy, family-centered practice, and culture-centered music therapy can offer therapeutic activities much better. If therapists know beliefs and customs of their families, of their clients, they can assume children of those families follows their parents' thoughts. For changing clients' thoughts, cognition, and their behaviors, therapists may use CBT. For this purpose, therapists may use prepared songs, improvisation, or own composition to encourage clients to change their negative views to positive and constructive thoughts and behaviors.